Welcome to the Classic Lounge in case you're just tuning in. It's also time, of course, for us to get into the brief where we look at stories making the rounds in the news. Okay, and today we're going to, of course, get into that, but we want to also make a focus on the issue of the health sector, basically, because we're in the middle of a pandemic. What it means is that there are very, very pertinent issues in the health sector rearing its ugly head every minute, right? One of which was the resident doctors going on strike. They had gone on strike and said that it was going to be indefinite, but there was mediation, from different angles, and now we have them back at work. It's not total though, because they're saying that they're just given time for the federal government to answer them, to assuage to their needs, and then the strike will be totally called off. So this is a sort of suspension of the strike. Basically, they have gone back to work. We're grateful for that, because the last thing you want is to have your health sector not have doctors during a pandemic. Anyway, so you can join the conversation, of course. Phone lines will be open so that you can be a part of it, but I have in the studio to help us just make sense of this Honorable Dr. Yusuf Tanko Susunu. He's representing Ngaski, Shanga and Yorik Federal Constituency in Kebbi State, and also the chairman House Committee on Health Services.
So the last name is Sununu.
Sununu.
Yes.
I beg your pardon, sir. Thank you for coming on the show.
Thank you.
Okay, so we had this indefinite strike that doctors said they were going on just very recently, and it kind of caused some sort of fear for a lot of people, because this is a pandemic. Basically, we're dealing with the novel coronavirus, and we need our health workers more than anything else. They did say that the people working, treating coronavirus patients would not be going on strike with them, but it was going to affect the entire health sector. Now they have suspended the strike to give the government time to fulfill outstanding demands. But your committee and the Speaker of the House, were also part of this mediation to help call it off. Let's talk about that for a minute.
Well, thank you very much. First of all, let me thank you for inviting me to your studio to address some issues that concern the House, and especially the intervention of the House of Representatives to move the healthcare forward. Well, when we came in, immediately after we were sworn in, the first thing that came was information going around that the Nigerian Association of Resident Doctors are going to have their next meeting, National Executive Council meeting, in Yenagua, Bayelsa State, around August, I think first week of August, within which they are to embark and declare a nationwide strike. That really information was given to a very good Samaritan to Mr. Speaker, who is also a listening leader. He immediately directed the committee to wade into the crisis, and then the first we did was to call them, and let us be frank, at that time they have honored the House through a phone call. We insisted that we wouldn't want them to declare the strike. They should give us time to mediate. And immediately the president of the association granted us his words that they are not going on strike since we have planned to intervene. So we had the meeting with them, and at that meeting the issues were brought to limelight, and some of the issues were there was a medical residency training act that was passed into law in 2017, which is supposed to come operational. This act is to guide the residency training itself. And what is residency training? It's a collection of physical, intellectual training to acquire knowledge, skill, to enable a doctor who is registered with Nigerian Medical and Dental Council of Nigeria to specialize and work independently on his own as a specialist, and can be appointed as consultant whose opinion will be sought, and also to be able to pass that knowledge, skill, and discipline to younger one. So this program is what has been sustaining the quality of our doctors
medical personnel,
so far we have
yes,
been producing in the country, and are well known all over
the world.
International world are coming to sort for them. So, but unfortunately, over the years, the program was not backed by any legislation, and that brought a lot of crisis within the health sector. Glory be to God, and then I must thank and give credit to distinguished Senator Bete Apiafi, who was then the chairman of House Committee on Tertiary Institution, now in the House of Representatives, and now a distinguished senator. She thought that the only way is to provide a legal framework upon which the program will be regulated so as to address the incessant strike coming from the doctors. And that act, the bill, came to limelight, it was passed, and then President assented and become an act. Now what next is the operationalization, and that's why we had issues. The part of the act specify and gave the regulation of residency funding to National Postgraduate Medical College of Nigeria. And it's also stated how a resident doctors can enter into a program and how he can exit. And also goes ahead to determine the number of years and stages of the exams that each resident is expected to pass over time so that he can exit, because it's supposed to be a program that will get in and get out so that we can continue to turn around production of specialists in the country. And it also mandated that there must be an online data of all residents in Nigeria. And also it comes with what an average resident should be taking as his allowance for that training. And, his working is also training.
Yes.
So that's in summary
the total package.
The act. But unfortunately, this could not see light of the day. Also, we have that there is also an arrears of short-off of salaries, because government at that time, most of the hospitals cannot pay as soon as they reach October. From October to December, salary, some hospital will be receiving percentage of their salaries. So that accrue over time to an arrears. And then the arrears were classified into two. The first is 3.5 billion, which the ministry and also the associations also agree with it. And there are other health workers that also have their own this. And then there is another group of 23 billion, which the ministry said they have a contentions with them, and that is now a matter of court. They are currently with the association in court.
Being litigated.
Yes. So the House cannot go into it because it's already a court matter. So, but the 3.5 billion that this thing, as of today, I want to tell you that has been paid as from the letter I've gotten from the Minister of Finance, and also from the confirmation done by the resident doctors. And the other health workers were also paid around 1 billion 498 million over the period of time. Okay. That's making the total arrears paid to 4 billion 980 million. So that's a part. They also demanded for them having issues of group life insurance. Their members are subjected to so many risks, and after the demise of a member, the family cannot benefit from the benefit of the doctor that died. Then the other issue that also was raised at that issue is because we are in COVID, they now came up with the special COVID hazard allowance, which the speaker also championed so that you can see it like today, and the government buy into it. And then, however, the payment was also delayed. This is one of the issues. Apart from that, there are also issues of resident doctors over time just being disengaged from residency program without recourse to the act that established the program. So they said that because such disengagement was not done in accordance with rules of law, they will not accept that this thing. And then lastly, the issue is also that some of their members, some state government in the country slashes the salaries of their members, despite the fact that they are at point of war now, but their salaries has been, instead of giving a special allowance to encourage them, the members' salaries in some states were slashed by percentage. So this is cumulated to, we have sat at the House of Representatives, and in fact about 7 times, with 4 of the sittings ably chaired by the Speaker. So we have gone into agreement with MOU with them, and also with the government representative. But unfortunately, over time, those cannot, the government part cannot
didn't see the light of day
with the agreement. So that necessitated them to go into
the
strike. Now, during the strike, we have not rest on our decision. We continue to intervene, and luckily for us, the issue of the COVID hazard allowance was in the budget, and also we must also appreciate the role by the Federal Minister, the Minister of Finance, for even going ahead to mobilize more money from different sources, pending the assent of the budget by the president. So as of today, the 2 month, the first tranche of 2 months is being paid to hospital, except those who have computation problems. It's been paid in batches. A lot of hospitals have gotten that part of that money. And also on the issue of the personal protective equipment that they have also demanded as part of the reasons for the this, especially now that we have so many of their members being infected.
At the front lines and
the front line this is being infected. That also through the intervention of the House also, and also the effort of the executive, hospitals so far have gone ahead to receive a lot of personal protective equipment. And also in a motion raised for of urgent public importance on the need of personal protective equipment, the House at that meeting resolved that the contribution of the National House of Representative wing of the National Assembly to the fight against COVID should be used to procure in procurement of personal protective equipment.
Oh, that's great
this
to know.
This part of the intervention we have also done. And then apart from that, the issue of residency funding, we find that there is a delay. Now, Mr. Speaker, knowing that actually this country not only depend on residency program for the services they render, but we also need them to provide a higher skilled manpower through the program. Because I can vividly state that internationally, the effort and the training done by Nigerian specialists to pass skill to the younger one is acknowledged. You can only know that if you go to various websites and you see how international committee is rushing into Nigeria to recruit doctors to their respective countries, leading to what we call brain drain. And those the brain that is draining are naturally trained in the country. So this shows that our products are of higher quality.
Let's talk about the brain drain for a minute, because yes, it shows that we have a product that has been sorted for, but how do we make sure that we don't keep draining the brain? How do we make sure that these doctors don't keep leaving Nigeria? We need them.
Very simple. Political will. Where you have a political will, everything can be addressed. When you have political will, that will now propel you to increase your budgetary allocation. And in fact, we have Abuja Declaration that call for at least 15% of total revenue of the country to be allocated to the health sector, health services.
That has not been happening.
And that has not been happening. We have less than that. So with more money, you can build more infrastructure. You can standardize your training. You can also increase and diversify the services being provided. You can recruit more personnel. And then with this, you can also add to it special incentives that will retain those with rare skill in the country. And once they are retained here, and you also widen their scope in terms of research, because everybody wants to develop. He has interest in research, and the country is giving not giving him that exposure. He can go out so that within short was done, he become an international researcher of record that can fetch him more money than even the pay.
And recognition, you know, which is important.
So with that, I think if we do that and we upgrade our infrastructure, I assure you that the brain drain will be addressed. And then we'll now be moving from not only addressing drain, changing brain drain to brain gain, and also from foreign exchange loser to foreign exchange earner. Because the more we standardize our skills and services to international standard, I assure you market will open. But India, that's what India did.
Yes,
they sent so much of their manpower skill to go outside UK, Europe, and study, and then open up with incentives so that they come back to the country and establish a standard private practice. 90% of the patients living in Nigeria to India are going there to be attended to in a private clinic because of what the government made provision and open up the private practice so that people can come and practice.
I mean, one of the things,
even go back down the lane. You remember that there was a time even Saudi Arabia used to come to Nigeria to go to University College Hospital and access healthcare services. But now if you try to put on table healthcare delivery services in terms of financial investment and that of Nigeria, between Saudi and Nigeria, there's something you cannot.
There's something wrong with that. So at the end of the day, we need to get to that point where we take up the budgetary allocation for health and push that. I mean, is that something that you have agitated for as a lawmaker and of course the chairman of the Committee on Health?
That I've agitated and I will continue to agitate, and even now that's what I'm saying. That for the country to get it right, we must identify health as a priority, health as a form of security, health as a necessity. Now, why am I saying this? In the last 2-3 months, be it that you can have 100 jets, you can travel out of the country at any time you want. For example, because there is an international restriction of travel,
yes,
you cannot go out of this country. So you must remain here. If you are sick, you will remain here. And you must be treated by the kind of
investment you have put in there
that we have on ground.
I mean, but that's the thing. A lot of politicians travel out of the country.
If we are serious, we must learn from this lesson, so that we can now put our hand on deck, and work hard to ensure that we sensitize our healthcare, so that we move from what we are now in a country whereby the almost 90%, 95% of your income, your access to healthcare is out of pocket. You must put your hand in your pocket and pay for the services.
Insurance.
So that we can now move towards achieving universal health coverage. And what is that universal health coverage? Simply putting it, average Nigerian getting his healthcare requirement and demand when he needs it without suffering financial hardship. This is very vital. I've seen couples that the wife is I'm a gynecologist before becoming a legislator, whose wife was in labor. He has to go and borrow money. He borrowed money and come and pay for the services, surgery and everything. He couldn't pay. He has to sold out his farm to pay the debt that he incurred. What's the meaning of that? Subsequently, he cannot farm. And what is that?
He can't provide for his family.
Pushing him into financial hardship while trying to regain back his lost health. And that should not be the focus. That
should not be happening. Yeah, but there have been people who said that, well, the reason why there's been so little put in the way of health when you talk about budgetary allocation over the years is because there's nothing compelling Nigerian leaders to stay here and access healthcare. It seemed a little extreme and far-fetched, but some people have proposed that there should be some sort of legislation to make sure that if you are a public officer in Nigeria, you should not be seeking healthcare abroad. Do you think that should happen?
You see, I may tend to disagree or agree with you. I can never say straightforward yes. Health is a personal, when it comes to this.
Yes.
When healthcare becomes mandatory, yes, you can say people shouldn't go anywhere, but even in that circumstances, I have the right to choose where I want to be treated, where I have to go for treatment. But the only thing is that while making that decision, if I made that decision while actualizing it, I should not use public fund. I should not use public funds.
So that's something that can be legislated. Don't use public funds.
Yes, you cannot use. You shouldn't use public fund. And even if you can come, we cannot say that as at today, Nigeria can provide 100% services we needed in healthcare. No. I'm a specialist and I know there are services that are not readily available
in Nigeria.
So in such kind of cases where we don't have that services, a room must be created where people can go and access and restore their healthcare. You understand? Even if you go to UK or United States now, you see a lot of Americans going to other countries to seek for healthcare.
To seek for healthcare. Absolutely.
If you go to India, you meet them because it's more cheaper in India than other countries.
It's just a lot here in Nigeria.
Put it as part of their travel holidays, so that they can go there and also access their healthcare during holiday. So it's a choice. But what we are trying to say is that while doing what you want, don't use public resources
to pursue it. Okay, let's talk about state houses of states, because you're a federal legislator, so you can intervene at the federal level. But there are states who keep owing resident doctors. Some states governors will even tell them if you go on strike, we'll fire you, or you won't have a job and things like that. What kind of intervention can you provide in that instance, knowing that it is sometimes just a state issue?
Yes, I think I quite agree with you. As House of Representatives or the National Assembly, we don't have time mandate to make a jurisdiction for the states because they have their own state assembly.
Yes,
but we have a very good relationship, and we can capitalize on goodwill to temper justice with mercy in state. For example, we had a public hearing. The Nigerian Governors Forum chairman, the governor of Ekiti State, was around. He made a presentation, and immediately after the presentation, I followed him outside, and I said, Your Excellency, the resident doctors are on strike. While we are addressing the issues of the federal government, there are also some issues arising from the state.
Yes.
Please use your goodwill to see how you can intervene so that we can fast track the calling off of this strike. And frankly speaking, he also played a role. And he has approached he sat down with the Association of Representative Doctors, and he invited them to the Nigerian Governors Forum by a virtual meeting, and they discussed a lot. And he's working to see how all those issues that are addressed can be issues raised by the state can be addressed. And also, not only that, Mr. Speaker, on personal ground, has also reached out to a number of governors to address the issues because he's concerned. We cannot only say that we'll be at ease when the federal doctors are working. No. We have the health workers down to the wards level.
Yes.
And those also their contribution is also noted and must be taken with all
absolutely. Now let's talk about Abuja. Yes, let's talk about Abuja here. Just a few days ago, we had frontline workers. This is not actually even doctors. They were mostly investigators, sample collectors. They said that they were working at the front line in Abuja here, where the COVID-19 fight is concerned, and they protested that they had not been paid hazard allowances for 3 months. So I know about what you're talking about with resident doctors, but these are other frontline workers that are saying that they've not received their hazard allowance here in Abuja. Yes, and there was a protest just a couple of days ago.
If you've come to Federal Capital Territory Administration, healthcare delivery system, we also have this thing. If you know, we know there are voluntary workers and there are also conventional staffs. Even the conventional staff had the issue that National Assembly has weighed in. And what was the issue? It wasn't the issue that it was generated absolutely as a fault of Federal Capital Territory Association. No. It was the issue of the Federal Capital Territory found it mandatory that, look, let us regulate our workforce through a system. And the management decided to get itself involved and upgrade its payroll to integrate it into IPPIS. But unfortunately, it took over time. From January to almost April, staffs were getting half salary, and some were not even getting salary. And the House, through Mr. Speaker, also intervened. We went into it. We were able to find where the problems are, and then we have acted promptly, and the issue of the IPPIS is almost nearly corrected. In the last correspondence I have, it's just very few problems, and the problems, we have addressed them. We have now allowed them, the IPPIS, through its director, and the leadership of Joint Health Sector Union of the FCT, that's Jesus, so that I can sit down, and also the Association of Resident Doctor FCT chapter to address those issues. Now, this issue that we are now talking for the volunteers, I think also the issue of computation also came to fore. And I am sure, though I haven't got any official correspondence to that effect, but I do believe from the sincerity of the minister that I knew and his commitment towards addressing issues, as we just, because when we invited him during the conventional workers crisis, he was so sober about it, and it's not something that is anticipated. And even the workforce of FCT made it clear that over the period he has been as a minister, at no time their salary exceeded 25th of this. But you just have to move to IPPIS, and unfortunately, the delay came up, and that was the issue. So I also believe that this issue of the volunteers on the hazard allowance, he will surely do something like that. It will be done.
Okay. We are hoping to see that, taken care of, as well as the issue of the resident doctors have been taken care of. Let's talk about it. We're going to wrap up very shortly because I did promise you 30 minutes. Let's talk about this proposed infectious diseases bill. Apparently it is still there. It hasn't been passed, of course. According to the speaker, he says that they're taking different inputs from different organizations. Where you're looking at the NGOs and concerned stakeholders basically about it. So it's not like it's cast in stone, but the argument that it might come across as draconian and, impede the rights of people, do you see that with this bill?
Let me first of all commend all Nigerians. We are the representatives of the people, and we are elected to do what people want us to do. When the bill was placed for first and second reading and what followed thereafter, the third reading was suspended. Nigeria came out and voiced their demand. What is their demand? Subject this bill to the court of public opinion. And Mr. Speaker, being also a Democrat, and the House generally, we have to advance our motion for third reading and then replace that motion to defer the bill to the public court for them to come and make their input, so that whatever will be the outcome of that bill is something that will be owned by all of us, and it's something that will be meant to serve the purpose for which it's.
I mean, there are arguments that there's an act before. Why don't you build on that? Why are you doing something entirely different?
Okay, I didn't finish my explanation, but I can still address this issue. You see, a house is a dynamic institutions that is governed by rules and regulation. The rule and regulation is established, and there is also a provision you can suspend your rules. For example, now, there is what we call, I'm just citing your example as legislative activity. We have what we call motion of urgent public importance. The rule says you can only take 2 motion at a day. But a time will come when we are going to sit over that week or during the weekend. We have about 6-7 issues that are of urgent public importance, and they need to be addressed. So somebody within the House will move a motion for the suspension of the relevant rules to allow those to take motion as at that moment, at least more than 2. It can be 3, 4, 5, 6. You understand? And then the House will debate on it and will pass and agree that it should be taken. And then it will be taken. So also a bill can come. Not only the infectious disease bill, we have had stimulus economic bill that was also passed in the House. It was presented. Relevant rules were suspended. It was taken the first, second, and third reading. And even the budget, at the times we find that there are issues that will come. It all depends on the focus of the House to see it has to intervene.
Yeah, you said you were going to address what I asked about. There was something on ground before. Why not build on that? Why something entirely different? Why the infectious bill is concerned? And also, I'm sure you have heard about the accusation that the House was given some money to push this bill.
You see, I'm happy you said the word accusation. And the House on its own, when that accusation was mentioned, has debated the accusation. And the leadership and also all the members, including those of us, made it plainly clear that a penny has not touched or hit our account on that regard. And the House moved a motion that should be investigated.
So is it being investigated?
And the committee is investigating. Now I don't want to say much about it because already those who alleged could not come forward, and now the case in the court. So because it's a matter of court, I cannot. It's
in court right now.
Yes.
Okay. Let's talk about the fact that there was a report on this day that mentioned the fact that media wasn't really allowed to cover the public hearing of the infectious bill.
I also want to thank you for raising this issue. There was a misconception. One, the advert was mentioned, inviting general public to submit memoranda, and then to be there also, but using COVID-19 guidelines. You understand?
Okay.
The public hearing was aired by IIT. It was also aired by channels. Channels was even live. NTA was even live, and also further carry everybody along. The committee on its own for the first time. I directed that we should have a Facebook outlet which can be viewed internationally.
Live.
And it was covered live in Facebook. It was also covered live in YouTube. We are also consistently notifying the public of who is presenting, what point is making through our Twitter handle. Now, what happened to the issue of the journalists in the house, we have journalists. We have two. As at that meeting, we have journalists who have COVID-19 pass to cover activities of the house, and those who don't have COVID-19 pass. You understand? And even if all of us,
did people know that? Did the journalists know that you are supposed to have a COVID-19 pass to get in?
They all have it.
Because the according to the report, they're just saying that you are the one who was screening journalists that would come.
No. Let me explain my this now so that you can this. Now, what is the issue now? We have a hall that normally contains only 300 people, and this is a public hearing that we have received so much correspondence, with so many people coming, including governors and ministers, head of the agencies and rest. Now, each governor may come with 4 or 5 or even up to 10 aides. But you know what to do? We said, no governor will go inside with an aide. They all enter alone so that we can maintain, we want the capacity of the hall not exceed 120. Now, if you have so many journalists coming, the only way you can allow all of them to come is for you to break the guidelines of the COVID-19. Otherwise, you must have the criteria. And the criteria already that the house have a pass for our members that will go in. But nevertheless, I think there was a communication gap between the committee and those who are charged of this, because I can't go anywhere. But what I want us to, what I believe is that the public hearing was done live and nobody was excluded.
So what stage is this bill right now? Are you still going forward with it?
See, making bills are different places. Immediately after, once you have a public hearing, you must have a draft writing of your report.
Public hearing, according to reports, a lot of people were still against the bill. So what's the way forward?
No, you see, if you say a lot of people are against the bill, there are a lot of people which are against some provision of the bill. For example, people said Nigerian Governors Forum said they are against the bill. The correct position of Nigerian Governors Forum, they have accused that too much power was given to the DG NCDC. They have also agreed that there are some areas that are of arrest and orders that can be abused. They also said that state government were given minimal role, unlike the position that was given to them in the current Quarantine Act that we are trying to repeal. And they also made their suggestion that there should be sections that give them power in the current Quarantine Act, especially Section 8, that give them the leverage to give rules and regulations and orders where President omitted in his own this. And we have that is something.
So all of that is in consideration. So the bill is going through some sort of redrafting right now.
And not only that, I'm telling you that the Sultanate Council through was represented by Reverend Father. You understand? The Kanwe there, virtually every religious group and other things were there. Market women, Women's Society, National Council of Women's Society, and they have all made
their contributions
and raised contribution on areas that they have seen by their thing as the draconian. And what I told you is that even at the public hearing, we made mention that people opinions matters, and the House will look at what people see.
Okay.
As representative of the people, so that we do what exactly will help this country. I'm telling you, Honorable Speaker, Right Honorable Speaker Abdul Hakim Femi Bajabiamila has no special interest in that, but except to move this country forward. And as far as healthcare is concerned, I told you he has been intervening. And most especially, all the intervention we have done, call those Association of Resident Doctors, call FCC Jehisu. Most of those intervention has done at the instant of the House, just so that we can act promptly to prevent the calamity that will befall this nation.
As we round up, tell me, what do you think about the Nigerian response to COVID-19? How do you think we're doing so far?
Well, the Nigerian response for the COVID-19, one will cannot say it's excellent exactly or not. Because if you are in a situation, you must look at what are compounding factors for you not to behave the way you want. Compounding factors are so much in Nigeria, and that has to do with level of our economy. If you want to wear face mask, it requires money. Social distancing means that you have to also distance. Lockdown in a house, when you stay in a house, a lot of us have to go out and work to get what they will eat. You understand? But by and large, despite the compounding factors,
Yes.
I want Nigerians to know that it's always better to be safe. And you can only be safe when you comply with instructions. Instruction has been given out by the Federal Ministry of Health, by the Nigeria Center of Disease Control. And even for the first mark, people have gone far to improvise rather than using disposable. They are using ones that
the
you
one
can
that
wash,
you can wash and
you
use
can
again.
sterilize. You understand? That's why I like Nigerians, because we are innovative when it comes to issues to suit our setting. But the only thing we can get it wrong, if you want to play the fight against COVID-19 as it is played in UK or it's played in United States of America, we must look at, and that's why even in what we are now trying to develop as a bill, we are trying to incorporate research as a special area.
Looking at our environment to
so
suit
that
us.
what we have there, as soon as there is a declared pandemic, researchers must move fast to look at what are the factors that will further worsen the spread or cultivate it, and see how they can now translate it to suit our own local
The
environment.
Nigerian society, basically.
Because if we didn't do that, you are going through this thing.
I mean, even in the UK and the US, they're struggling, so they're not even the best model to look at right now.
So so we want to see what in the end what we have. Our prayer is that we should have something that all of us can want it, and all of us can be able to implement it, and see we move this country forward.
Okay,
but one thing of assurance is that we notice areas that people are mentally opposed to, and we are also working to ensure that where they have recommended, things go the way they want it.
Okay. One last thing. I know of somebody who was really ill, and she tried to get treatment in hospital, and a lot of hospitals were turning her away just because they were not sure if she had COVID-19 or not. And there are a number of people who she couldn't access treatment for a while because of that, for like 2 weeks. So it just made me realize that there might be more people who can access treatment because of COVID-19. So there's that fear of hospitals. Of course, most of them are not licensed to treat COVID-19, and the time it takes to get tested, and now be able to access treatment if you're negative. If it is a debilitating situation, the person can just lose their life. What can we do to address that?
You've already made a point earlier that even the developed world are being challenged. COVID is a lesson to the whole world. Nobody anticipated for it, and therefore different countries have their different pattern of response. While doing that response, some will make mistakes. As you are going, you are adjusting. If you look at the history, right where you go down the lane, when we started, we only have 5 laboratories that can diagnose COVID-19 in the country for a population of almost 200 million. And we even the house, we said, oh, that is not acceptable. And today we have over 30-something laboratories that come up over the time.
But it's still difficult to get testing that easily.
You see, it's not that easy. It's not saying that difficult to this thing. The way people want is for I told you that when you are fighting a war, there must be a planning and replanning. If you allowed every hospital or every laboratory to test for COVID, you may end up getting it wrong. Some may not have the capacity, may not have the skill, may not have the training, and they will go on testing people and you'll be getting fake results. That is one aspect. And then if they lack the training, the worst part of it is that they can also prone themselves to risk. We've seen centers that initially, all of them, immediately the laboratory was open, you found that up to 50% of the staff are infected. The ACDC has to come and shut down the lab, and then go back and give necessary training and this thing. You understand? So we have to weigh between the risk and benefit. The risk is that if you say everybody to test for COVID-19, you may expose so many dangers to wreck. The maybe is that many tests will be done. Now, when you compare the many tests that will be done with number of people that may be unfortunately infected during that training, what do you do? So you must be guided by evidence, and that's why we're emphasizing the need for research. But the other issue is that also there is also fear, and Nigerians who are good at stigmatization. If, as a practitioner, I manage a COVID-19 patient in my hospital, now my fear is a suspected this thing. My fear is post-COVID. Will I lose my patient? Or patient will still come? They say no. If you go there, you get COVID. You understand? So that fear of stigmatization made a lot of private practitioners to shut down their services.
But we have to look for a way to make sure that Nigerians don't suffer. In the fight against COVID, that they can still access healthcare. Just because there's COVID-19 does not mean that I should not get treated.
I agree with you, 100%. We must get ourselves treated, and that's why in the house we work hard to ensure that the other issue we had, that where the services go down well, of which we've also mentioned to the PTF, is the fact that in our planning we forgot initially to take care of public hospital, and we concentrated more on building capacity and protection in isolation centers. And what is the defect of this plan? This public hospital that we left like that without much to be done.
It's the first point of call, basically.
It's the first point of call. So one person with COVID will come and infect 50 of them. Then you now say, okay, it's positive. Move him to isolation centers. In the
harm is already done.
As he is in the isolation center on his third or fourth day, those healthcare personnel that treated him in the public hospital will now be his neighbors in isolation center. So I think that's why I say we are learning. But now with the realization of that,
so there's capacity building in public hospitals now for COVID-19.
And also the availability of personal protective equipment also came to light. So these are issues right here.
Thank you very much, Dr. Tanko Susunu, for coming on the show, honorable member of the House, and helping us make sense of this. I mean, there are a number of issues that you did clear up, so thank you.